I am Dr. Parimal Lawate. I am a practicing gastroenterologist and liver specialist in Pune for the last 25 years. Today we will be discussing about two liver diseases which are caused by viruses, hepatitis B and hepatitis C. Both these are viruses which can affect the liver and they can permanently damage the liver in few patients in whom the liver gets affected. These are both transmitted by blood and through sexual transmission. There are some people who get it from their mother during their birth, and there can also be cross transmission between people who are in close contact. Well, there are various ways in which you can get hepatitis B and C. One is you can have sexual transmission. The other is you can have it from your mother if she is infected at the time of childbirth. You can have it in people who share needles and who are intravenous drug users. You can have it as interpersonal transmission, especially in children if there is close contact between children. And sometimes you can get it through unprotected sex if the person involved is infected with hepatitis. I think people who are at risk of these situations which I mentioned, they should be screened for hepatitis B and C. And this is done by way of blood tests, and there are two blood tests which are done for screening. One is a hepatitis B surface antigen test, and the second is an anti-HCV test. Both these are done on the blood, and they have to be done by a specific method called as ELISA for HBsAg, and a third generation assay for the anti-HCV testing. Once a person is positive, there is some risk that this virus may permanently damage his liver over the next 15 or 20 years. It's important to remember that these are not, in many patients, they are not very rapid infections, in the sense that if you get hepatitis B or C, it is not very likely that these infections can sometimes cause acute damage, in the sense that the person gets infected and suddenly the person who is infected can deteriorate. But by and large, most patients who have hepatitis B or C, they have a slow ongoing infection, and there is adequate time for the healthcare workers as well as the patient to get himself evaluated and treated. So once there is infection with hepatitis B or C, it takes somewhere between 10 to 15 or even 20 years for the liver to actually get damaged. Once you make a diagnosis of hepatitis B or C, what the doctor tries to do is to try and find out whether this virus is multiplying in that patient's blood by doing certain tests, and also by seeing if there is liver damage by doing certain tests such as liver function tests, sonography, and many other tests which are now available. These patients, if they are diagnosed with hepatitis B and C, especially for hepatitis B, it is very important that the family is screened for hepatitis B, because a lot of patients who have hepatitis B will have one or two family members or even their parents who are positive for hepatitis B. Now, what are the symptoms of hepatitis B or C? By and large, it is very important to remember that both these infections do not cause any symptoms, or the patient may not really have any complaints unless the disease has gone on in progress to damage the liver. So it is important to have screening of individuals who are at high risk for hepatitis B and C at an early stage, so that you diagnose these patients in an early stage and where treatment can be offered. All these patients who are infected do not require treatment, but those who have a multiplying virus in their blood and who have liver damage, they are the ones who require treatment. There is very effective treatment for hepatitis C, and there is very effective treatment for hepatitis B as well. And for hepatitis B, in fact, there are a wide range of treatments which are available and which can be tailored as per individual needs, so that you can attain a permanent cure in these patients. Hepatitis B and C can both be prevented. For hepatitis B, there is a very effective vaccine which offers almost 100% protection to individuals who get fully vaccinated. For hepatitis C, unfortunately, there is no vaccine, but there are ways of preventing it by doing screening when using blood products and so on. Once you have hepatitis B or C, it is very important to inform your healthcare provider or the doctor that you are infected with hepatitis B or C, so that he can take adequate precautions while doing various procedures. Then he can advise family screening and other things which can be done to protect your liver, especially in these individuals, is to avoid alcohol at any cost. If you look at 2014, hepatitis B and C are quite easily diagnosable diseases. If the diagnosis is made, there is no need for the patient to get depressed, because if it is made in an early stage, there is very effective treatment for both these disorders, and you can get a permanent cure for both these disorders.